Well, hello there and welcome to our discussion. Today we'll be discussing hypertension. My name is James Sams and we have Dr. Vipin Khetarpal here. I practice family practice and he is an awesome cardiologist. Today the topic is hypertension. So let's just jump in and ask, what is hypertension, high blood pressure, what does it mean?
So what it means is that circulatory system in our body is a fascinating closed system. So you have heart as a pump and all the big arteries are like these little drain pipes that go from there, and their purpose is to take the blood and give it to different organs in our body so that the organs get oxygen and nutrients. So it requires a certain pressure head, like in any closed pump system, it requires a certain pressure head to be able to push that and push it through to different organs and the small arteries and capillaries that are present in our different organs like kidney, like heart itself, like brain. And when that pressure head goes high, then the nutrients and the oxygen still gets delivered, but it starts damaging the organs where it goes. And that's where lies the importance.
I was about to ask, what's the big deal about hypertension? I mean, why do we need to be even concerned about it?
Yes, so that is the big deal, is that it essentially is an asymptomatic condition. It doesn't cause symptoms till it has damaged the organs. And that's why it's important to check it and control it, because sometimes that damage can be irreversible. It is an important risk factor for many diseases, for heart disease, peripheral arterial disease, strokes, aortic dissection, atrial fibrillation, and even cognitive decline. So you can gradually lose your mental faculties and memories if the hypertension goes undetected or it goes untreated.
How do we check for hypertension?
So checking for it entails, a visit to a physician, and we have two types of instruments. One is a manual instrument where we, check it manually, inflate the bulb and inflate the arm cuff. Or there is a automatic electronic where you just simply wrap it around, push a button, and sort of the robo-nurse, so to speak, takes the blood pressure and heart rate. The other modalities are some fancy things where we can actually even send you with a monitor at home to record your blood pressure 24 hours when you are in your own home environment, which we use sometimes particularly for patients who complain that they have white coat hypertension, or when you say they're always high but they swear that it's always normal at home, and that is one way to confirm that.
I think that's a good point, because some people say they go to the doctor, it's always high there. That's exactly right. Knowing what the blood pressure is at different times and knowing the cause of it, and certainly just being in certain situations, the environment can have an effect on it, and white coat is. When you have a diagnosis of hypertension, what do we do with that?
So first is, being aware that this is an important thing. This is something we should all get checked for from an earlier age, starting, right from childhood. A pediatrician should pay attention to it. We were talking about how common this disease is. There are about 80 million people in the United States who have it. And about 1/3 of world's population has hypertension. By the time we get to be 75, about 80% of us will have hypertension. And once we confirm and you talk to your doctor and get readings done once or twice in appropriate settings, and we come up with the diagnosis, then there are some basic lab investigations that need to be done, like an EKG, certain blood tests, which include a thyroid function study, calcium levels, your kidney function, electrolyte levels, and after that starts the journey with the treatment. And I call that a journey because a lot of hypertension goes underdiagnosed or non-diagnosed, but a lot of hypertensive patients are not controlled very well. About 50% of the patients who are getting treatment for hypertension actually are not at their target level. So there is a lot of work to be done. And which brings us to the question that you said about hypertension. It's a twofold strategy. One is the non-pharmacological treatment, and then comes the pharmacological treatment. And they both go hand in hand. One is not a substitute for other. If you start a pharmacological or drug treatment, doesn't mean that you can do whatever you want with everything else. So also you have to, first of all, the non-pharmacological part, you have to look at salt consumption. Typically, what is recommended is a 2-gram sodium diet, but that's actually very hard to follow. A 3 to 4 or 4.5 grams sodium diet is a reasonable diet for it. Daily exercise, no alcohol or at least moderate alcohol consumption, avoiding artificially sweetened caffeinated beverages like a diet Coke or caffeinated drinks, or those are to be avoided. Make sure that you have some discussion that you don't have sleep apnea. Those are some of the contributory factors for either leading to hypertension or poor control of hypertension if you are taking medicine. Then dietary, two kinds of diet. There is a thing called DASH diet and another thing called Mediterranean diet. The basic thing in both of them is about the same, as you know, that stay away from red meat, stay away from salts, include more fruits, more vegetables, particularly fresh fruits in your diet. In Mediterranean diet, there is a particular emphasis on nuts like hazelnuts, like almonds, like walnuts, and more fish in your diet, and less of saturated and more of polyunsaturated fat, and things like canola oil or olive oil, which are rich in unsaturated fat, and staying away from butter.
When you say that, I think another thing to bring up is like who would be inclined to have it, knowing your family history. The apple doesn't fall far from the tree, so if your mom or dad has it, knowing that you could be in line for it is a big important thing to look at.
And you are absolutely right there. You're absolutely right there. There is a huge genetic predisposition to it.
All the way around. And I think you bring up a good point about it being a silent killer. It's one of those things where I think sometimes we treat our cars better than we do ourselves, in that we can see what's going on with the car. We have engine lights that are clicking, whereas with blood pressure, if you don't check it, you don't know, and it can sneak up on you, that's for sure. So what else, when you talk about diet, you talk about medication, do you have any other recommendations?
Those are the two main things. Then the other thing is that 90% of these hypertensions are what is called primary hypertension, or for which you basically can't cure it, but you treat it. Then there are about another 5 to 10% of the patients who have what is called secondary hypertension. And those are the patients where you look for a cause for hypertension, and if you remove the cause, you can actually cure the patient of their hypertension.
When you talk about that, let's talk about the consequences of blood pressure that's not controlled.
Yeah.
Can be pretty devastating.
Yes, they can be very devastating. And at the same time, the important part is this, that these are very easily fixable, or sort of a low-lying fruit in terms of how effective they are in decreasing your risk. So for example, if you decrease your blood pressure, your systolic blood pressure by 10 to 15 millimeters of mercury, you can decrease your lifetime risk of heart attack by 50%. Now that's a very cheap fix if you really think about it, that decreasing your risk of heart attack by just simply decreasing my blood pressure by 15 millimeters of mercury, decreasing my risk of stroke by 40% by simply controlling that blood pressure, my risk of atrial fibrillation. And if you have all these factors combined, so the more risk factors you have for cardiovascular disease, i.e. if you are a diabetic, if you have high cholesterol, if you smoke, then controlling your blood pressure gives you much more benefit than another person who doesn't have these comorbid conditions. So it's very important, very effective, and at a community level and at a sort of at a public health level, it's a very important thing. It's a very important.
Very much so. And when you talk about that, when you have those multiple comorbidities, you have hypertension, you have high cholesterol levels, you have diabetes, and then, oh, by the way, you're obese and you smoke, it's a ticking time bomb as far as that goes. How do you think we can engage the public to be more involved with their own health? I mean, to be more proactive? I mean, certainly having these discussions can do it. What else can we do to get their attention?
So main part there is education, and having that discussion is very important. Sometimes I have seen in my practice that showing them a graph, showing them this is how much is decrease in your mortality, is important. If you tell them you are between 50 and 59, and if your hypertension is uncontrolled, your risk of dying in that decade is 5%. But if I control your hypertension, it comes down to 2%. That's a fairly effective chart. And show them. Sometimes I'm not trying to scare my patients, but I've shown them, I've shown them pictures of hearts that have been affected with heart attack, or flabby hearts, pictures where they are in heart failure and heart is not beating well. You can show all that. And another thing is the risk of kidney failure and dialysis. Nobody likes to be on dialysis. It's a modality once you are end-stage renal disease to treat you, but it's not a good, pleasant treatment. Males have a risk of impotence, and sometimes that clicks with them and say, hey, you are a diabetic, you smoke, your hypertension goes uncontrolled, you are going to have sexual dysfunction. So if you don't want that, which, everybody sits up and pays attention to that, it's an important part of our life and lifestyle, it works as a motivator for a lot of people.
Knowledge is power, and it's a matter of finding how to get that information across to individuals and what hits with them. I think the take-home message is we got to start somewhere, and that is find out what your blood pressure is. And if it is high on that single time, I think it's also important to bring out what else is going on. Okay, you're at this office, it's high there, take your cuff home. We can see it in the comfort of your own home where there's no stress or anything else like that. So,
Absolutely.
If there's a parting words of wisdom, what would they be from you?
So parting words of wisdom would be, both for physicians and for patients, you are equal partners in this treatment. One cannot be successful without the other. For physician, it's important to check the blood pressure, be very meticulous about that control, and for the patient to be an equally important party to it, be compliant with your medication, make sure you don't run out of your scripts, follow the diet, and other non-pharmacological suggestions made by your physician.
Excellent. I think that's some great information for us to think about. So on that, thank you for joining our discussion, and we'll see what our next topic is going to be.
Thank you.
Have a great day.
Thank you. You too, Dr.